So I'll ask you and our listeners to move to the front of the chair. If you're standing, it will also work in standing, but if you're on a chair, just move forward so that you're not leaning back, so that you can move. And then put both hands, one on top of the other, on your breastbone. So you feel the bone that holds your ribs together. And just feel the weight of your hands, the weight of your arms. The gravity is working on you. And follow your breathing. Follow the movement of your hands as you breathe. Is there any? Are they moving in space at all? So something, the shape of your rib cage changes when you breathe. This is just, it has to happen in some way. So accompany this movement or even exaggerate it a tiny little bit with your hands. So when you breathe in, your hands go a little bit forward and up with your breastbone, obviously. Maintain the contact. And when you breathe out, they kind of sink in and down. A little bit is a very small movement. Just more in a more conscious way, following the action of breathing. So just keep going. So you notice that your hands are moving, your breastbone is moving, forward and up a little as you breathe in, down and inwards as you breathe out. And now make your hands a little more active so they become lighter and kind of suggest the way forward and up as you breathe in. So maybe there's more movement in your rib cage as a whole. And when you breathe out, feel the weight of your hands. Allow gravity to pull down a little bit your breastbone. So you make your arms a little heavier as you breathe out. They become lighter as you breathe in and heavier as you breathe out. So we are exaggerating the movement of the rib cage. And you can follow this movement with your eyes. And this may have already happened naturally, that when you breathe in, there is some movement forward in your chest, so your gaze raises a little. It goes a little bit upwards, and you're not doing it with your neck. It's just because your head is on top of your chest. When you breathe out, there is some rounding in your back, very, very light, and your gaze goes a little bit down. Okay, and let's take it another step forward and imagine the shape of your spine. And maybe as part of this movement, you can again exaggerate it so that the whole length of your spine arches a little as you breathe in. So you stick your belly a little forward and your chest a little forward and up. So the shape of your spine changes, it arches. And then when you breathe out, round the whole length of your spine a little more. So your chest sinks some more, your hands are heavy, your gaze goes a little bit down. So as part of your breathing, you arch your back to breathe in, you round your back to breathe out. And you may even notice that something is changing with the way your sitting bones, your pelvis, is supported on the chair, because it's connected to the spine. So we're again exaggerating the action of breathing. You open your chest forward, arch your back, lift your gaze to breathe in, and then everything becomes heavier, sinks down. You round your back as you breathe out. Let go of it, put down your hands, and just sit for a moment before you go back to the normal mind activity. Just take a look at yourself. What does it feel like to be seated and to breathe?